Hi, I'm Dr. Erika Krumbeck. Welcome to NatPeds Pro, where we break down evidence-based research and whole body approach to pediatric care. This channel is for healthcare providers looking for clear, research-backed insights into treating pediatric patients with confidence. Don't forget to like and subscribe. Let's get started. First thing that I would like to talk about for pediatric anemias is that fatigue is a late finding for anemias, or really for any serious medical condition for children. If a child is fatigued, other than maybe they're sleep deprived, so they're not going to sleep regularly, but otherwise if a kiddo is fatigued, usually that's a very late finding, and really any child with significant fatigue deserves a pretty thorough workup. That is not normal. It's such a common, and we sometimes say like normal finding in adults, maybe the most common finding in adults in our practices. Adults or parents complaining of fatigue. And so, that's what we're kind of used to. But for children, if they're not able to keep up with their friends on the playground, if they're complaining of being tired a lot, if they're sleeping more than normal or sleeping more than what would be age expected, that's actually really serious and needs a pretty thorough workup. Most kids will have other findings, other significant findings way before fatigue. We know that children with iron deficiency can have signs of learning disabilities, of inattention, of all sorts of things, especially in the academic world or in school. And really, they just have iron deficiency. So that's something I think is really important to go over. I think it's also really important to talk about ideal ferritin levels in kids. And again, this is another time that we cannot take expected lab ranges for adults and apply them right across the board to children. A normal reference range for ferritin for adults, let's say adult women, might be something like 15 to 150 nanograms per ml, if I'm correct. In that reference range, most adult patients will be symptomatic. They won't have anemia yet, but they will be symptomatic when their ferritin drops under 60. Some sources say 75 is ideal. So when we are working with women who are complaining of chronic fatigue, they have like insomnia, anxiety, and especially hair loss, the research is pretty clear that a ferritin level over 60 is necessary for best hair growth, best happy brain chemicals, things like that. For children, we almost never see a ferritin level get that high. So the ferritin reference range in a conventional lab is somewhere between 15 on the low end and often maybe 70, 80 on the high end. And typically a ferritin for children, again, when it drops below 15, for adults or for kids, then typically we'll see direct signs of anemia. But the question here is, what is an ideal ferritin level for children? We don't really have a ton of research on it, so it's based on really my experience with kids, but we don't see high ferritin levels in children because they're growing. It's a different story for both adults and kids. When we drop under about 10 nanograms per ml for a ferritin level, we're going to become frankly anemic, so actually see signs of anemia in the blood. But it's before this that we're going to see signs of iron deficiency, so signs and symptoms of iron deficiency. So remember, the body is going to prioritize using iron for red blood cell production because it's more important for the body to carry oxygen than it is to have healthy hair, nails, skin, good immune system response, happy brain chemicals. All of those are things that are going to be underperforming while the body is prioritizing putting iron into hemoglobin so that we can carry oxygen, because that's the priority. So in this case for children, whereas for adults, again, we see ideal ferritin levels over 60, for children, we just never see it that high because they're using that ferritin, they're using the iron to grow. So my estimations, and this is not based on documented literature because it's very, very, very difficult to find, but ideal ferritin levels in children are around 30 nanograms per ml. And that's because typically beyond that, the kids are just using it to grow. So when we're seeing kids in the low teens or even mid-teens of a ferritin level, we really do want to get their iron levels up to address some of these other signs when they aren't frankly anemic yet, but they're still having issues with concentration or depression or anxiety or moodiness or irritability. I think it's really important to address that iron deficiency.